Next up is diagnosis. How do we diagnose it? So diagnosis is mostly based upon our clinical observation. We can clinically see the patient and then yeah, diagnose it. Yeah, this is the case of acne. No investigation is required in this case. Hormonal tests only if the PCOS are suspected. Then we do hormonal tests, and finally serum testosterone and DHEAS. These are the tests that we do in case of hormonal instabilities. Okay, otherwise no investigation is needed. Next up, we have got management. What is management? We have got two types of management: general management and specific management. First, here we will be discussing general management. What is general management? So first of all, the most important thing is the dietary management. What we advise to the patient is that they must quit fast foods, because fast foods are, like, these are enemies of our today's generation. Fast foods can trigger acne, so we must advise patient to quit fast foods. No oily stuff. They shouldn't eat any kind of samosa or any pakoras. So no oily stuff should be taken. Stop smoking. If he's a male, then he should stop smoking so that his acne couldn't get worse by the irritants of smoke. Eat healthy vegetables, fruits, and drink plenty of water. This is the normal advice we do for skin. This is the, like, basic requirement of our skin. For our skin to be healthy, we must eat healthy vegetables, fruits, and we should drink plenty of water so that it remains hydrated, and it produces that glowing effect without any cosmetic application. And then we have got avoid oily cosmetics. They shouldn't use comedogenic cosmetics. Do not squeeze the lesions. This is what most females do, and we must advise them to stop doing this, because those lesions, once they touch the lesion, the fingertips, they are also contaminated with the bacteria. So those bacteria gets entry into the comedones, and then they cause further pustules and papules formation and inflammation. Gentle cleaning with the face wash and use of sunblock cream. Okay, these are the general measurement. Now next up is the specific treatment. What is the specific treatment? Topical treatment and systemic treatment. It depends upon the severity. If we have got mild to moderate form of acne, then we will give topical treatment. If we have got moderate to severe form of acne, then we will include systemic treatment along with the topical treatment. This is the topical treatment. We will give benzoyl peroxide in topical form to apply on the pustules and the on all the lesions. Topical retinoids, vitamin A, has the beneficial effects in the prognosis of acne. Topical antibiotics on the pustules to prevent any superadded infection and the infection that is already occurring, and azelaic acid and salicylic acid. These are the topical treatments we will give to the patient. And then we have got systemic treatment. Systemic treatment includes oral antibiotics and or oral isotretinoin, hormonal therapies in case of hormonal imbalance, and then we have got our oral contraceptives, spironolactone. These are the systemic treatment options for the. Okay, so next up is the indications of isotretinoin. Isotretinoin, we give it in oral form, and we advise it to the patients in these conditions: those who have got severe nodulocystic acne, resistant acne, scarring acne, and acne with psychological distress. Okay, in these conditions, we will advise isotretinoin to the patient. Now, we have got some other conditions in which isotretinoin is contraindicated. Those are also important. First of all, it is contraindicated in pregnant females, and secondly in the lactating mothers. Why is that? Because of its teratogenic effects. Isotretinoin is highly teratogenic, so in pregnant ladies, in pregnancy, it can cause babies birth defects, okay, like spina bifida defects. So we must not give this medication to the pregnant ladies and to the lactating mothers. So that's why we must ask about the marital status of a lady before giving isotretinoin to her. Okay, so that is the contraindication of isotretinoin. These are the indications. In these conditions we can give isotretinoin. And what are the conditions in which we can't give isotretinoin? That is pregnant lady and the second, lactating mother. In these two conditions we won't give isotretinoin. Next up is the rosacea. Rosacea is similar to the acne. Rosacea and acne both present in the same form, but there is a mild difference, just a mild difference in rosacea and acne, and from that difference we can tell apart that whether it is rosacea. Okay, so here is the definition. That is, it is the chronic inflammatory facial dermatosis. What is it? It is chronic inflammation of a facial skin. Okay, that is the same thing as that of acne. It is characterized by flushing and erythema, redness and flushing. Absence of comedones. Comedones are absent. This is the main important point. This is the only point that will define whether it is acne or whether it is rosacea. It's the absence of comedones. In rosacea, the comedones will be absent, but in acne, comedones will be present. Next, we have got central facial involvement. In rosacea, we have got central face. Central face is most often involved in rosacea, but in acne, not only face but the trunk, upper limbs, and shoulder, back, or chest, all of these faces, all of these structures and sites can get involved in acne, but in rosacea mostly central face is involved, that is forehead, nose, cheeks, and chin. This is the central face. Next up are the clinical features of rosacea. Clinical features: facial flushing, persistent erythema that remains persistent, that doesn't go even with antibiotics or even after some days. Telangiectasia is the defining feature of rosacea. It can also occur in acne, in severe form of acne. What is telangiectasia? It is the presence of visible capillaries and visible capillaries. You will be able to see capillary network in rosacea patients. Okay, that is telangiectasia. So it will be present in rosacea. Papules and pustules, same as acne. And then we have got burning sensation. This is another differentiating point. In rosacea we have got burning sensation, but there's no such sensation in acne unless it is nodulocystic in nature. Okay, then we have got types of rosacea: erythematous, telangiectatic rosacea. From the name we can tell that it involves erythema and telangiectasia. These two conditions will be present in this type. Papulopustular, here we will see only papules and pustules. Phimomatous rosacea, here we will see localized swelling and cellulitis of a part of face, like nose, forehead, even chin. If the nose is involved, then we call it rhinophyma. And finally we have got ocular rosacea. Ocular rosacea will involve eye. Okay, then what are the triggers of rosacea? Sunlight, hot beverages, spicy foods, alcohol, stress, heat. All of these are the triggers of rosacea. These could not trigger acne as well, but acne is most commonly triggered by the excess sweating. Like any condition that will lead to the production of excess sweat and sebum, that will trigger acne. Okay, next, treatment: avoid triggers. This is very important, as much important as the medical care. So avoiding trigger is important. Sunscreen, and then we got topical metronidazole, azelaic acid, and oral doxycycline. Doxycycline is the antibiotic which we will give in this condition. Next up is the acne versus rosacea. Okay, so here's a comparison between acne and rosacea. In acne, we see comedones, but there are no comedones in rosacea. Acne is most common in teenagers, as I already mentioned. but it is most common in adults. Rosacea is most common in adults, sometimes secondary to the steroid use. Sometimes patient come to us with steroid application in the face, and after that they develop rosacea. And finally, acne is associated with oily skin, mixed type skin, but it is rosacea is associated with it could occur even in dry skin. And the main sensation, burning sensation, flushing, that is present in rosacea. Okay, thank you very much. If you have got any question, you